not a single incident actually moved me to cancer care. It was like when I was getting myself trained in England, this was one specialty which was developing. This was one specialty where lots and lots of questions were there which were unanswered. And these unanswered questions actually motivated me to get into this specialty so that we can find out those answers and can help the society. Sacrifice from my side, I don't think that I've made any sacrifices because it was my selfishness. This was the career which I actually chose, so the hard work which I put into it was required and I was well prepared for that. But yes, my family has actually given a lot into it, and while I was training, it was like they missed me. They didn't get enough of my time at that moment of time. And now also when I'm practicing it actively, a lot of my time actually goes into my cancer practice and with my patients. So my family is the one who has actually sacrificed. If you love doing something, you'll continue on doing it. Since I was in my school, I wanted to be a surgeon, and when I started my surgical training, I wanted to be a cancer surgeon, and when I was into my cancer surgery, I wanted to be an oncoplastic breast surgeon. So it is, I like my profession. It's not like a burden on me. So that's just, my love for the profession is what which is actually keeping me to move along with it. It could be a difficult question, but I'm going to say that I'm blessed with this. Despite seeing me so much into with my patients and not giving them enough time, my kids have actually chosen medicine as their career. And at this moment of time, when they are into initial phases of their life and into the medical career, they tell me that they want to be a cancer physician. And my daughter, obviously, she wants to say that she wants to be a breast cancer specialist surgeon. Stress, I don't see any stress in my work. I enjoy my work, so there's no stress into it. Disappointments, yeah, sometimes you are disappointed because there are cancers which you actually expect to do good, but results are not that good. There are cancers which you want these patients to get fully cured and do well, but they recur. So these are disappointments, but these are like, this is a part of life. We know that not all cancers behave in the same manner. So we've learned to live with this. In terms of work-life balance, I think I'm poor at that, but my family is doing it. So they are making up that balance with me. So they're moving with me. So. Yes. I'm very much satisfied with it, and I can change few things if I really want to relive it. I want to be an oncoplastic breast surgeon only, but I will make some changes into my lifestyle, into my training, into my practice, which I can't do now. But if I want to relive it, I will make some changes, but I still want to be an oncoplastic breast surgeon. What happens is, whenever you tell a patient that she has cancer, whenever you break this news to the patient and the family, it is very difficult for them to take it straight away. So there is a phase of denial. At that moment of time, give them open space. Be honest. The most important thing for carrying out a treatment or management plan for a patient is to be very honest with them. So what I actually do is, I break up the news in a soft manner. I give them time to speak, give them time to think over it. We don't do it in one meeting. So it is like, if you give them all the information in one meeting, they won't be able to digest it. They won't be able to retain it. And then we'll have 2-3 more meetings where they'll ask me questions very specific to their quality of life. Now, you very well asked about losing breast and losing hair. So these are two things which losing hair is very obvious. So this is something that society will perceive about that patient. So patient is very worried about their own personality. Losing breast is like losing half of your femininity. So they're worried about their own personal life when they think of losing breast. We try to save as much as possible. We try, in case a patient is having chemotherapy for breast cancer, you can't save their hairs, but you can tell them, you can actually counsel them that this is a temporary process. Hairs are going to come back. And if you have developed that trust with your patient, the patient will very well retain this information that losing hair is a part of their treatment, which is necessary. The treatment is necessary, not losing hair, but it comes as a package. And once the treatment is over, they'll have their hairs back. Losing breast, we tell them that we can save your breast. There are people who actually, most of the people, they want to save their breast. So they ask us questions about it. They ask us questions about recurrence. And we have to be very honest in telling them that the overall survival is going to be same, whether you retain your breast or you lose your breast. Once they are satisfied, we proceed accordingly. And then, as I told you, it is the most important thing in managing any patient is to have a good rapport. Your availability is very important. They might have a question which sounds very useless to most of the people, but to them it is related to their quality of life. And as the treating physician or the primary treating physician, you should answer that question. You should tell them about, you should not tell that this is useless. You should tell them that this question has this meaning, or it can be framed in a different manner, and this is the answer to it. What is your availability for me? Would you be available whenever I need you? This is the most important thing. So as a patient, the most important thing, or what matters to a patient most important, is the availability of their treating physician for them.
I am from Bareilly. I diagnosed my problem on 23rd December. There was a lump. I consulted the ultrasonologist here. Then he told me that there is some metastasis and you should move out of Bareilly. Then I informed my relatives about this to inquire about a good doctor. Then they told me that in Jaipur we have Dr. Uttam Soni. You can directly go and consult him. I have one of my friends here. I asked him to consult other oncologists also. He inquired 4 or 5 oncologists at Bareilly. They all suggested about Dr. Uttam Soni. I am very thankful to Dr. Uttam Soni as he is very dedicated, thoughtful, compassionate, and he is updated by all recent trends of breast oncology. This was my best experience with Dr. Uttam Soni.
Month of the December, I got diagnosed early breast cancer. I was shocked with this news. It was a big mental trauma for me and my family. We met Dr. Uttam Soni sir. ये न्यूज़ मेरी और मेरी फैमिली के लिए बिग मेंटल ट्रॉमा थी. सो हम लोग इस न्यूज़ को डाइजेस्ट ही नहीं कर पा रहे थे कि ऐसा मेरे साथ कुछ हुआ है. इस न्यूज़ ने एक्चुअली हम लोगों को इतना हिला के रख दिया था ना, हमको लगा कि शायद सब कुछ खत्म हो गया, बट नहीं, खत्म कुछ नहीं हुआ था. जब मैं डॉक्टर उत्तम सोनी सर से मिली तो मुझे लगा कि नहीं, अभी भी सब कुछ पॉजिटिव चीजें बाकी हैं एंड मुझे उस चीज को आगे लेके जाना है.